Good afternoon, everyone. We're going to let folks join us here and then get started in just another minute. All right, well, while folks are joining us, let's go ahead and get started with the presentation today. So welcome and thank you for joining us for today's virtual Lunch and Learn. Today is a collaboration with our partners at the Houston Business Action to End HIV, and we're really excited to present today's content to you. My name is Ryan Wilson. I use he, him pronouns, and I am the Director of Corporate Relations at the Greater Houston LGBTQ plus Chamber of Commerce. Um, we are also the managing partner for the Houston Business Action to End HIV in partnership with the Health Action Alliance. I do want to acknowledge that we have Jennifer with our administrative team helping us with Zoom today. So thank you, Jennifer Coleman, for being here with us. We're also excited to welcome the nonprofits, community partners, and businesses that are part of the U.S. Business Action to End HIV. And then we're also joined by Caroline, Abigail, and Mario, who are with the U.S. Business Action as well. Um, Today's session is being recorded and it will be available live on our YouTube later so that folks can come back and reference it, and also so you can share it with other people from within your companies. Um, Also, I do want to kind of just start out with a quick introduction to the Chamber if you're not familiar with us. Today's program is part of a quarterly webinar program or virtual lunch and learn program that we offer through our LGBTQ plus Workplace Alliance. The Workplace Alliance is part of the Chamber's programming to help large employers navigate a number of inclusion and DEI related programming. And in today's society, we're also looking at other ways to expand how we help support folks who are doing critical work around LGBT inclusion and also addressing the topics like HIV and other health concerns in our community. I won't go into the detail about all the events that the Chamber does, but we have events every week. We do over 100 events a year, and you can check out our calendar of events. The Workplace Alliance events are specifically for large employers, but we also have events for nonprofits and for small business owners. So we invite you to check out more of the Chamber's activities throughout the year. Just to overview today's agenda, we are going to hear from Mario Harper, who is with the U.S. Business Action to End HIV. Then Mario and I are going to have a little bit of a fireside chat, just talking about ways that ERG groups can do more to address the topic of HIV in our communities. And then we'll hear from Angel Ruo from Chevron. It's going to give us a little bit about what Chevron's doing. Chevron is both a member of our chamber and also part of the U.S. Business Action to End HIV on a national level and here in Houston. So we're really proud of them and their work. Then we'll hear from Vive Healthcare on some resources that ERG groups can tap into. And then we'll just end with some time for Q&A and next steps. So with that, I'm going to turn it over to our moderator today, Mario Harper, who's been working with us for over a year now as we build out this work here in Houston, and he's also working on this at a national level. So Mario, why don't you take it away and introduce yourself?
Thank you, Ryan, and hello, everyone. I'm really thrilled to be here with all of you today. My name is Mario Harper. I use he and him pronouns, and I lead U.S. Business Action to End HIV. We're thrilled to partner with Ryan, Tammy, and the Greater Houston LGBTQ Chamber through our Houston chapter as we leverage the capabilities of the Houston business community in our efforts to accelerate the ending of the HIV epidemic in the Houston metro area. Like you all, I have been a member of both business and employee resource groups. Being a part of these groups means that each of you value community and the well-being and advancement of the communities you represent, both professionally and personally. ERG groups specifically are uniquely positioned to act as bridges, connecting the workplace to the community and shaping inclusive health and wellness strategies. We hope that you walk away from today's meeting inspired to take action individually and cross-sectionally to invest in the effort to tackle one of the most hindering issues that impacts our communities related to HIV, and that is HIV stigma. As a person who represents an at-risk community myself, I can remember years of rolling the dice as it relates to accessing resources to ensure my own health and well-being. The idea of asking my doctor, family, friends, and work anything HIV related felt like a diagnosis in and of itself. And it was the main thing keeping me at risk. I was lucky enough to find community who directed me to resources and helped me educate myself on the seriousness of HIV and how to take control of my own health and HIV status. And I'm really excited to share some important and impactful ways that all of you can do the same, not just for yourselves, but for those on who you advocate on behalf of as a part of ERG group members. Next slide, Ryan. Before we get started, I'd like to share a quick video to better help those of you who are unfamiliar with U.S. Business Action in HIV, get a little peek behind the curtain of who we are and what our work represents. And here's a short video. What people should know about HIV is that we have every tool that we need to end the epidemic right now.
The vision of U.S. Business Action to end HIV is to harness the power and the reach of the private sector to help advance our nation's efforts to end HIV.
We still have people that are newly testing positive for HIV, and there is something that we can do about that.
We started with just 14 member companies 2 years ago, and we're now at nearly 70 companies, committing to hundreds of actions on behalf of their employees and their customers and the communities where they operate.
We put this coalition together for the purpose of businesses to come together and collaborate on opportunities to innovate.
What can businesses do to mobilize not only their employees, but also their consumers?
Every business has their own unique offerings, and they can use those offerings to really make a difference.
We had conversations with Uber. We had conversations with DoorDash to provide free delivery for patients that needed these critical therapies.
We get new ideas, we learn from other businesses, so we really can expand what we do and really bring that to our employees, whether it's to educate, empower, and to remove the stigma of HIV/AIDS.
When you think about healthcare decisions, the employers in our country play a really critical role.
Many of us have lived with HIV in our lives for most of our lives, and we recognize that this epidemic has transformed from one that was taking many lives to one that is now offering new hope.
Something that everyone that's a part of this initiative can feel proud of is that they're a part of a solution, of some legacy-defining work.
We've been incredibly proud of the work that this growing coalition of businesses has been able to accomplish. And we really look forward to seeing what we are able to accomplish in the years to come.
If you're on the fence about getting involved with this coalition, just stop, get off the fence, and join.
So thank you for sharing that video, Ryan. As you all saw in the video, the business community has willfully taken up this issue because they recognize the impacts of sitting on the sidelines. They also realize the potential to not only do good, but to build meaningful relationships, innovate on new ideas, and the legacy that taking up this work will leave behind. We now have 80 corporate members who have joined this effort, and we've mobilized more than 40 additional businesses and business leaders to take action. And so you can see on this slide here that these companies represent a diverse group from varying industries, all committed to the same goal of ending HIV in our country. Next slide, there we go. And so we've created a plug-and-play framework for businesses to take action towards ending HIV, giving each company an opportunity to do what they can. I remember companies take action by committing to any of the 6 activities that you see here. They raise awareness and visibility of HIV and publicly share their corporate commitment by extending a call to action. They educate employees about HIV and create psychologically healthier workplaces free of stigma and discrimination. They bolster HIV benefits and non-discrimination policies. They champion innovative public policies that accelerate access to HIV services. They leverage their unique expertise, infrastructure, and capabilities to implement innovative strategies to strengthen the delivery of HIV prevention and care. And then last but not least, at this very critical juncture in our government and in our times, they are providing funding to strengthen the public health response and to support HIV service organizations in local communities as well. And we support these business leaders by providing them resources and support to carry out their commitments, including hosting events and workshops like this one today, and providing free resources, communications, and sample workplace policies that can be adopted, customized, and shared with their respective workforces. So I'm sure some of you may be asking yourself, why Houston? So we launched our local chapters of our coalition in markets with high HIV prevalence and transmission rates to build bridges between the public health response and the innovative capacity of businesses in those markets. Houston ranks 8th in the nation for new HIV diagnoses and has lower rates of people who are HIV positive remaining in care. Houston also trails national averages in achieving viral suppression compared to the rest of the country. Black Americans, Latinos, and youth and young adults ages 13 to 24 are disproportionately impacted by HIV in Houston. Houston also boasts a bustling business community and is no stranger to innovation and resourcefulness, which can be critical for filling gaps in care experienced by these communities. You think of industries like healthcare, oil and gas, etc., who have deep-rooted operations and connection to the community all over the Houston metro area, and there's so much opportunity to make an impact. So in September of 2024, we launched our Houston chapter, and it is off and running. The images you see here are from our last chapter meeting held in February of this year at Amegy Bank, where members came together and workshopped ideas they could deploy to impact the local HIV epidemic. We saw real-time solutions being realized, and we aim to continue that momentum as we move forward and grow this chapter. We host these meetings quarterly, continuing to build upon momentum, creating connections, and identifying new ways to problem solve. So since our launch, we have already garnered the commitment of the companies you see listed on this slide, each making concrete commitments to address HIV in Houston, in their workplaces, and in the community. We've also mobilized additional companies in Houston who are not yet on this slide. We're willing to work with your company or your ERG group wherever you are, which means if your company isn't ready to add your logo and pledge commitments, there are still opportunities to take action, and we'll provide some ways you can do that a bit later in the program. We're also building a community of community-based organizations in Houston. These are nonprofit organizations who support communities impacted by HIV, providing a litany of services to direct people to and keep people in care. These organizations need our support in order to continue to do the work that they do to support at-risk communities. And the chapter provides opportunities to build direct relationships with each one of them. We encourage each of you and your teams to work with them also. And we've built a directory on our website where you can learn more about each of them and ways you can collaborate. And you can find the link to that directory in the chat. So to the meat and potatoes of the meeting, what is the power of ERG groups as it relates to addressing issues like HIV stigma? First and foremost, as advancing equity and inclusion. HIV disproportionately impacts certain communities, ones that are historically marginalized, like Black and Latinx communities, LGBTQ+ individuals, and then people living in the South. ERGs that represent or ally with these groups can amplify their voices and ensure workplace policies and wellness programs meet the real needs of employees in their communities. You can reduce stigma through visibility and education. As we've convened here to talk about, stigma is one of the biggest barriers to HIV testing, treatment, and prevention, and ERG groups can normalize conversations about HIV. You can also host educational events and model non-judgmental support, which will create a safer, more informed space for work and community. You can also expand access to resources. ERGs can connect employees to HIV testing, PrEP, and care through workplace health benefits or local partnerships. When ERGs champion these resources, they help ensure employees and their families can access life-saving support. Next, you can build trust with impacted communities. For companies working to build trust with communities impacted by HIV, ERGs are credible messengers. Your engagement signals a company's commitment is authentic, informed, and ongoing. It's not just a PR moment. And then lastly, you can activate company influence for good. ERGs can partner with HR, with corporate social responsibility, DEI, government relations, all of these different parts of the org to shape company practices from inclusive benefits to public advocacy that move the needle on ending the epidemic. So we shared a link earlier in the chat about our community partner forum. Now let's take a look. Now let's take a moment to talk about some of the ways your ERG groups can partner with local HIV organizations. First and foremost, you can identify a local public health official or HIV service organization who can be a guest speaker for a lunch and learn session to provide culturally responsive information about HIV to your members. You can invite a local organization on site to offer testing. Combining HIV testing with other routine health screenings like flu shots and COVID-19 testing or vaccinations helps fight the stigma by normalizing testing as a part of overall healthcare. You can encourage employees to volunteer with their local health department, HIV organizations, or other community groups, hosting HIV testing events and report back on your experiences. You can also take part in community or national events that bring communities together in the fight against HIV and memorialize the lives lost to the epidemic. And of course, last but certainly not least, you can fundraise to help support HIV organizations. There's never been a more critical moment for this one, as many of these organizations are currently anticipating closing their doors due to lack of government funding. And this is frightening, and it has the potential to erode 4 decades of progress in lowering HIV transmission rates and preventing related deaths. And so now I'd like to invite Ryan back to talk through how you can leverage your influence as ERG members to address this issue in more detail.
Thanks, Mario. I'm going to keep this slide up for a little while we're talking just because it's got some good bullet points on there. But, I sort of just off the top, one of the things we at the chamber realize is when you all approached us and said, "Hey, would you all want to be the managing partner for the chamber for the the Houston chapter?" Excuse me. We thought our chamber was in particularly poised as a place to start, not because HIV impacts LGBT people exclusively. We know there are many diverse chambers in Houston, but we at the Greater Houston LGBTQ plus chamber have relationships with those other diverse chambers, and we already have 65, almost 70 corporate or impact partners who are large employers in the area who might be open to hearing this message. So for us, it was a no-brainer to say, yeah, let's partner with you all and start introducing this topic to the folks we're already talking to about other inclusion efforts, but then not just stop there, but then try to go beyond that to expanding to other groups like African American groups, Hispanic groups, women's groups, other ones that are also touched by and impacted by this pandemic. It's not just the COVID pandemic; it's also HIV is still impacting the globe.
Yeah, it it oftentimes gets sort of relegated to specific groups, and we're learning with the data that, and we've always known that HIV doesn't discriminate, right? And I think it's incumbent upon everyone to make sure that they are knowledgeable about it, and then each one teach one, right? And I think that that's the power of what this relationship signifies between the Houston chapter and the chamber, is an opportunity to where you've already establish those relationships with your chamber impact partners and with these ERG groups within your network. And there's an opportunity for that community to make sure that there's an awareness and that there's a direction of resources to make sure that everyone's knowledgeable about HIV. But then also that we're spreading the word that unlike many other conditions, like cancer and diabetes and other things, there isn't a tool yet to solve for those things. We can end HIV right now as we sit here today. We have every tool that we need to end it. And we need to call on the business community to make sure that each company is leveraging the trust that they have with their employees, and ERG groups are leveraging the trust that they have with their communities to make sure that we spread that message and make people aware. So.
Right. Well, and that gets to that topic of stigma that you and I were that this has been built around, but that you and I have been talking about over the last few years that we've been working on this is, you talk about COVID shots and people run vaccination drives or flu vaccination drives all the time. Well, with PrEP and now with HIV testing the way it is, why are we not also offering those same services as just another part of your medical care and your health and wellness? It seems to be that there's this sort of stigma that still creates a barrier to creating access to these care products, and not doing events as often around HIV, as you could be doing with or that we do see with COVID and other diseases.
Totally. And HIV was the blueprint, right? We managed our COVID-19 pandemic because of all of the work that happened over the 80s and the 90s and the early 2000s and HIV. But HIV is also one of the most stigmatized issues that there are, right? And even when we talk to healthcare professionals, oftentimes they don't believe it exists in their population. Well, it does, and oftentimes that much like I mentioned at the top of the call, people don't know how to even talk to their doctors about it, right? And people don't know how to talk to their family about it or their friends about it. And so I think there's a normalization around HIV that needs to happen. It's no longer the death sentence that it was. And I think the only way that we fight through that thick wall of stigma is if we normalize conversations. And again, I know the group that we're speaking to here today are largely ERG group members. And I think there's a great role for everyone on the call to be able to normalize those conversations to help us break through some of that stigma.
Yeah. And then the last thing I kind of want to hit on, and I'll drop the link in the chat, is just the fact that there are so many different testing days and awareness days that are in the calendar already happening around the country. I really think for groups that are already planning Bisexual Awareness Day or Lesbian Awareness Day or Pronoun Day, like there are other topics that folks could be building into their calendars. Thanks, Abigail, for dropping that in there for us. There's Latino Awareness Days and African American Awareness Days that tie in with HIV, and so this would be a great cross collaboration moment for the Pride ERG to reach out to the Black ERG and say, hey, let's work around this testing day and do an awareness campaign together. I'm sure companies will like to see that their ERGs aren't working in silos, but actually collaborating. And if they're addressing a health outcome at a company, that's going to help your health insurance plan. That's going to help your productivity of staff who aren't missing days, right? So there's some business reasons that a company might be wanting to address these health awareness moments. And it's just given to you because it's right there already in the calendar. You can just work them into your annual calendar of events you're planning.
Absolutely. And I love what you mentioned, the cross-sectional approach of ERGs. I think, like you said, it's a great way to raise a health and well-being issue that impacts, again, all communities. HIV doesn't discriminate. And utilizing these awareness days is a great way to do that. Abigail dropped the National HIV Awareness Days. We're going to talk about a specific one that's upcoming a bit later in the program, National HIV Testing Day. But these are all really, really critical ways, again, to normalize routine testing, normalize conversations, get people in the know about HIV and learning prevention and treatment opportunities are available. So.
And to cap that off, and then I'll turn it over to you and Angel. But there are organizations on this call and in our community that have mobile testing units who can come out and do presentations or partner with an ERG group. So it's not like you have to come up with all this stuff on your own. That's what's so wonderful about the community partnerships is there's already great HIV prevention work happening in Houston, and we can tap into that because many of those nonprofits are associated with our chamber already. And so that can then bring the expertise that you need to come help you with those events, and you don't have to look far.
Absolutely. Absolutely. Well,
All right,
thank
well,
you,
let's
Ryan. This
step
is
away and I'll let you all take it from here.
Yeah, it's been a great conversation. I'd like to welcome Angel Rua to join me to provide some insights on the great work that he and the team at Chevron's Pride Network have been doing um, for destigmatization and HIV inclusion. In their framework, Angel is a human resources advisor at Chevron and the president of the Chevron Pride Network. Hello, Angel.
Hey there. Glad to be here. Hi, everyone.
Good to see you. Tell us, why has your ERG prioritized HIV related programming and how does it align with your overall inclusion goals?
Yeah, thanks for that. So for us in the Pride Network or Pride ERG, it's our LGBTQ plus ERG, right? This has been a cause close to us, right? Given the impact it's had to the LGBTQ plus community. But I'll also echo, what was said earlier that this is not just an LGBTQ plus issue, right? And Chevron has always seen this as a human rights issue that really goes beyond just one particular community. I think it's important for us, right, to create opportunities for connecting to community. And one of the big things that our ERG does with, kind of just presenting pride related content, right, from an ERG perspective, it's really about promoting education and awareness. So topics on HIV, stigma, understanding people living with HIV and things like that really fit well within that remit, right? Within the educating our colleagues, right? It also supports well-being. I think that's, we're now having, and ever since the COVID pandemic, we're having broader discussions, right, across all the ERGs with regards to mental health, well-being. A great intersection that occurred, and I think it was the year before last for Hispanic Heritage Month, our Hispanic ERG reached out to Pride and wanted to feature a panel of different LGBTQ plus individuals. One of those individuals was someone, right, who had a story surrounding HIV. Right. So I think that if I were to give advice to other ERGs, is sometimes it's really bringing in all the communities, right, and showcasing it from all perspectives that I think it gives you the biggest bang for your buck.
I love that, and you answered one of my next questions. The advice of what advice you would give other ERG leaders, and I do think bringing HIV into the fold with other issues, with other communities, and allowing people to see have a human-centered approach around it, right? A whole healthcare type mindset about HIV. I'm curious, how do you approach building partnerships with local or national HIV focused organizations, and what have those collaborations look like for Chevron?
Yeah, one of our big partnerships here in Houston is with the Allies in Hope, right? Formerly known as the AIDS Foundation Houston. We have been a sponsor of their World AIDS Day luncheon every year, where we get individuals, and again, it's not just Pride ERG leaders, but leaders from across all the ERGs, leaders from our corporate medical group, right, who get to come out and really represent Chevron. We've got a long history in this space since the 80s, and our HIV/AIDS policy, our corporate policy, has been in place since 2005. Right. When I think about partnerships, it's really centered around that policy, right? And so we've got a corporate medical team, right, that really drives and manages those partnerships. And I would say the ERGs are kind of like the force behind it, or the volunteer community behind some of those efforts, right? So the Pride ERG recently led our participation in the Walk to End HIV just a couple months back here in Houston, right? And so you have the corporate medical team kind of owning that partnership, right? And that partnership relationship, right? But then you've got the ERGs really activating them, right, in the community with boots on the ground and people showing up. So I think that's one way, right? In some cases, and some companies may not have, like, let's say, a big medical group, right, to manage these. But I would say, think about, like, where are you applying other social investment, right? So that could be your avenue in as well, to really try to bring in partnerships within that community.
Absolutely. I'm going to go a little bit off script here, and I hope you'll humor me, Angel, but you answered all of my other questions in your response because you're just so thorough, and I can appreciate that. In your estimation, why should the ERG groups that are here today, why should they care about this issue?
I think it's a matter of recognizing, right, that this disease cuts across all groups, right? And again, it's not just a one ERG alone can't say, well, that's just that ERG's problem, right? And I think that that's where it cuts across and it makes it very real for people, even people who are not directly impacted, right? You live in a community. The stats that you shared about Houston were very, very sobering. I wasn't familiar with those, right? And it really showed how you've got something to share with people who reside in this city, right? This is something about the city that you can share with individuals, right? And again, I also loved what you said about take one and teach one, or I
Take
can't
one,
remember
teach
that was the exact
one.
phrase, right? But with that mentality, the intent of your ERG programming may just be that, right? May just be creating awareness, just giving people the tools, right, to understand what's happening in their communities, and if they choose, how they can get further involved and make a difference.
Absolutely. Thank you so much for
Yeah.
sharing all of the impressive ways that Chevron has raised this issue of HIV awareness and inclusion across your ERG network, Angel. It's really
Thank you.
been a pleasure, and we appreciate you as always. And now I want to welcome Bianca Ward, External Affairs Community Liaison at ViV Healthcare, who will give a quick presentation on some of the ways that the ViV team can work with each of you and your companies to adopt HIV awareness and resources. Um, Bianca, I'll let you take it away.
Thank you so much, Mario. Good afternoon, everyone. Thank you for giving me the opportunity to be here and talk about ways that we can partner with your organizations and companies and the amazing work that's already happening. My wonderful colleague Tiffany is going to share the slides for me. I appreciate it. Again, as Mario mentioned, I am the External Affairs Community Liaison with ViV Healthcare. I have the honor of covering the DMV, Baltimore, and Richmond. You can go to the next slide. A little bit about who we are for those who might not be familiar. ViV Healthcare is the only pharmaceutical company that is solely focused on HIV treatment and prevention. On the external affairs team, all of our work that we do is really rooted in community voices, community empowerment, and stories, and making sure that we are censoring those voices in order to continue to work towards ending HIV. Next slide. So this is our awesome team. I like to call us the Divine Nine, but then people are like, no, you can't do that. So I so I won't. But there are 9 community liaisons, primarily in the South and Southeastern United States. Between the 9 of us, we cover 27 territories and cities. So we are hopefully where you all are, but happy to bring our um, collaboration efforts and our educations to you all either in person or virtual if you are interested in that. Um, a lot of our work is around community education and collaboration building. So these are the areas of the country where we are doing that. But again, we are available virtual as well. Next slide. So I would be talking specifically about our immersive learning experiences, which are really kind of another, a better way to talk about our trainings and education that we provide. And all of those really align with making sure that we are centering patient voice, patient advocacy, and patient experiences, along with making sure that our community partners have all of the tools, the information, and knowledge to also uplift their communities as well. Next slide. So our immersive learning experiences are just that, immersive, deep in conversation and discussions that really center awareness, empathy, and action. And that's kind of how we move through all of our presentations with insightful experiences and really making sure that people feel seen in the information that we are presenting to them, and also are empowered enough to share the information that they're receiving as well. Next slide. So our ILEs are this is sort of the anatomy or how we do this. And they're done a few different ways through traditional kind of PowerPoint slide decks, but also our conversation cards. So it's not just a PowerPoint, but really an enriched conversation around social drivers of health, ways that our identities show up in terms of how we impact our health, what HIV looks like in our history and in our community. One thing to note that our immersive learning experiences are also available in English and Spanish. And I realized that I didn't say the most important thing, and I got this feedback last time when I was in Atlanta. All of our trainings, our ILEs, are free. I will say that again. They are free. Last time I was like, I should have mentioned that at the top, but we are definitely love free. Exactly, Caroline. So we are excited to bring those opportunities to you in order to enhance the experience of your colleagues and companies. Next slide. So this video will hopefully work and have sound.
What if I told you where you're born, work, play, worship, and love can all have an effect on your health? Factors like stigma, structural racism, access to healthy food, to safe housing, to transportation, and to healthcare. What if the reality is that our health is shaped by political, economic, and social drivers? Well, maybe the factors that challenge us don't have to predetermine our fate. This is an invitation to Fate versus Factors, a part of the Domino Effect series where we explore the intersections that influence our health and ways we can take action in our own lives and the broader community to improve health outcomes. Imagine a world where people who were barely surviving are thriving. Throughout the experience, we facilitate journeys that offer a deeper understanding of factors that can influence our health. Through storytelling focused on empathy, the group pivots to scalable actions that can be taken on the individual, community, and national levels. We are always better together and even stronger when we understand how to help each other through our unique challenges. To learn more about bringing this experience to your organization, contact a ViVE Community Liaison near you.
Thank you. So sorry. So Fate versus Factors is just one of our immersive learning experiences. And just as the video eloquently mentioned, it's really about seeing ourselves, how where we work, born, play, worship, how it impacts our health and the health of our communities. And therefore, what can we do in order to change the narrative? As you can see in the next few slides, they'll just kind of be brief overviews of some of the immersive learning experiences that we offer. And then if you look to the left, all of our experiences have, we always ask for feedback. So all of our trainings have about a 95% or above satisfaction rate. Go ahead to the next one. Diary of a Virus. I know before you all were mentioning about the HIV awareness days, Diary of a Virus is definitely one of our ILEs that I like to highlight around any of the HIV awareness days that you all are participating in, because we're talking about the history of HIV, not just from a medical lens, but specifically how it's impacted our communities and how we are part of the story of HIV and what we can continue to do to bring about awareness for prevention, care, and treatment. Next slide. This is one of my personal favorites. I like them all, but this one really, I feel like, yes, it is available in English and Spanish. Sorry, I won't look at the chat, but feel free to drop questions. Pivot to Power is great because we're kind of having deeper conversation about our social identities, race, gender, wealth, etc., and how that impacts our lives, our health, the power that we have in relation to those identities, and how we can kind of hone that power as a community to achieve goals together. Some of those goals just being better health outcomes. But I really like this one in particular because it takes us through a journey to see all of our humanity and how we show up, and the impact that that has on how we also treat others. Next slide, please. Slow to heal. I know that also something that I heard being mentioned, I believe it was Mario, but talking about how we talk to our doctors about our health. So Slow to Heal is a great, really community conversation about how we rebuild trust with our providers in our healthcare systems in order to have better health outcomes. What does it mean to have a partnership with your providers to be able to talk about all of your health concerns or conversations around HIV prevention and your treatment options, but slowly empowering our communities to have their voice when it comes to their own medical care. So, Slow to Heal is about rebuilding the trust, but it really is also about empowerment. Next slide. And then this is one of our newest immersive learning experiences, Project Disrupt Makers of the Movement. And in this one, we're talking about what it looks like to be an advocate and an activist and how we channel our beautiful anger, as it says here, in order to create the world that we want, to have impact in our movement, in our personal health, but also in the systems that we want to improve upon in order to really support our communities. Next slide. So I will begin to wrap up, but one of the things that I definitely want to mention again, one, free. All of the immersive learning experiences are free. They can be done in person and virtual. They take about an hour to an hour and a half. They're really meant to speak to diverse audiences, and that's one of the things that I appreciate about them when I do them here in the DMV area. I'm having conversations not only with community-based organizations, but also places of worship, colleges and universities, support groups, community events. So I feel like all of our ILEs get to the heart of community and spark change and creative thinking and empathy and awareness, which we definitely want to do, while also, most importantly, tying in those important conversations around our health and how we empower our health and the health of others. So if you are interested, of course, just you saw this and you're like, yes, please, we want more of that. We want these amazing community liaisons to present to our ERGs, to our companies. We are here to provide that support. And you can do that by contacting the email that's here on the slide. And I also believe that the catalog of all of our ILEs, this is just a few, will be sent out as well. So you can kind of just get a full breadth of what we can offer. So we look forward to hearing from you all and working with you all more closely.
Thank you, thank you, thank you, Bianca.
Welcome.
What an incredible breadth of resources. And I'd like to remind everyone that they are all caps FREE3.
Most
So
important.
most important. So please, please do take advantage of these and tell, your colleagues, tell your friends who work at other organizations or are part of ERG groups and networks, and spread the word. Um, Thank you so much, Bianca, for joining us today and sharing. Um, as we close, I want to invite those of you, if we can get the slides back up, there we go. I want to invite those of you who aren't yet members of the Houston chapter to join. There is strength in numbers, and if we are to reach our goal of ending HIV in Houston, we're going to need all of you, and we're going to need you to spread the word. Everyone tell someone as well. You can scan the QR code on the screen, or you can use the link in the chat to learn more about us and to join the chapter. Come check out one of our upcoming meetings or events. Start to receive our newsletters and resources as well that are free and downloadable on our website. Next, June 27th is National HIV Testing Day. And testing again is so critical for all of us to know our status. And we encourage all of you to join us on May 21st for our National HIV Testing Day workshop, featuring speakers from KFF, Match Group, Mercer, and Walgreens. You can learn more and register by scanning the QR code on the screen or through the link in the chat. You guys are getting lots of links in the chat. Hope you can keep up. And that concludes our program. I'd love to answer any questions that you may have, so feel free to enter them in the chat. And I think Ryan is going to be monitoring that. And yeah, we'll answer questions. We'll take questions now.
Yeah, sure. We're a small enough group of folks just want to also ask their questions. They can come off mute as well.
Perfect.
While folks are thinking about if they have questions, one, I just want to again point out what Bianca offered, that some of their programming is also in Spanish, another intersectional opportunity. The other thing that she mentioned that it sort of resonated with me is the advocacy component, for anyone who leads an ERG, in some way you're an advocate. You are asking upward for things, and then you're also working downward to try to engage more people, right? So those of you in those leadership roles might benefit from some of the skills that might be taught in an advocacy program that you could then apply to other things that you might be pushing for, advocating for, both internally and also in the external community. We at the Chamber really do believe that we need to be pushing for representation and engagement at the city, state, and national level on many issues. And so grab those skills. Those are good ones to offer as well.
Absolutely.
All
And
right, there's a
yeah,
question from Maxwell. If you want me to read it, Mario.
yeah, go for it.
Do you partner with organizations that have a chapter in North Texas?
So we do not yet have a chapter in North Texas. So we aren't directly partnering with organizations there, but we do have companies who have business operations in North Texas, and oftentimes they will ask us for community organizations that they can partner with and do match days and things of that nature. And so and I actually just moved from Dallas to Pittsburgh, and so I'm very familiar with those organizations. And I know that Vive has some organizations that they're working with there. And Bianca, if you want to come off of mute and talk about maybe some of the partnerships that you guys have there, that might be helpful as well.
So one of the things that I could definitely uplift, I'm sorry to say that I'm not as familiar with our Texas partner, but we do have an amazing community liaison there, Demetrius Walters. She covers Dallas, Fort Worth, and Houston, and so she would be, and I know she's been working in community and with community partners in that region for a long time. So she would definitely be an excellent point of contact and just connector for those who are trying to partner and expand their reach.
It's great. And I will say a goal that we have for these local chapters, like the one that we've set up here in Houston, is that we will be able to sort of write a playbook of sorts for areas, because we're limited in our ability to reach all of the jurisdictions that have high HIV prevalence, but to be able to write a playbook and have that be inclusive of all of the organizations that exist within those particular jurisdictions, and ways that businesses can work with them as well. And so great question. And I know that there's some wonderful organizations out there. Prism, Abounding Prosperity, there's a number of them. So
And Mario, any company can join the national HIV effort, correct? Not just specifically the Houston, Atlanta, or LA ones. You also have the national umbrella.
absolutely, absolutely. Absolutely. So if you are interested in joining, like I said, there's a link. There was a link shared earlier in the chat, but feel free to reach out to us at endhiv@healthaction.org as well. And we'd love to talk to you more about what membership looks like.
And while we're here, I do a shout out to Christopher from the ExxonMobil team. That's walking in a walk to end HIV is a great example of an activity that ERG groups can do together to help represent their company, but also raise money for local organizations like Allies and Hope. So definitely use the walk every year as a good programming piece as well. That's always a good opportunity.
Absolutely.
Any other questions for us today?
Hey, I've got a question for Mario, and curious if you all are experiencing any setbacks or obstacles, hurdles with the current administration, and kind of what the focus is for the business actions remit, um, and yeah, I'm just curious.
Yeah, it's a great question, Angel. Obviously, this is a very sensitive time for a lot of organizations. As I alluded to earlier in the program, a number of our community partners are on high alert and very concerned that they may not be able to continue providing the services that they've been providing. Many of our businesses who are members of our coalition are impacted in different ways. Um, One of the programs that we have within our coalition is a government relations cohort, or we have industry action cohorts, I should say, as a program. And one of those cohorts is a government relations cohort where people focus in organizations on policy and advocacy type objectives are convening to determine strategies that can be useful to alleviate some of the issues that we're seeing as a part of the fallout with certain policies or funding mechanisms and shortages and things of that nature. And so I encourage those of you on the call who are members or those of you who are interested in being members to join and participate in that cohort, stay abreast. This coalition has penned letters to the federal government, including DOGE and others, advocating for sustaining HIV funding. We're learning every day about new, funding streams that have been cut short, and so we continue that advocacy and the utilization of the strength of this group. As I mentioned earlier, the strength in numbers, and obviously business plays a big role in how government and particularly this particular administration responds. And so, the more stakeholders we can get engaged on that front, I think the better our response can be, and the better the more ground we can cover with the actions that we take. And so, to that end, Angel, to answer your question, yes, we've seen um, some impacts for sure.
Yeah, thank you. Appreciate that insight.
Yeah, great question.
I'll share just a sort of tangential thing that we've seen is so we do understand that some companies may be experiencing a decrease in funding for some of their DEI related efforts. And I think this initiative is a great pivot where you can then focus on diverse communities and their needs, but come at it from a business case from the health perspective. And really, like you're helping your company's bottom line if you have healthy workforce that are not having to deal with chronic conditions or are not worried about getting access to health care for treatment because their insurance plan doesn't even cover HIV or PrEP and things like that. So this is something that folks could work on that isn't specific to a specific racial identity or sexual orientation. And maybe these types of health outcomes could be a focus for groups if identity is something that your company is sort of steering away from. And this could then give you something to work on at a moment when we still need to keep doing good work and moving the needle within these companies and in our communities at large.
Yeah, absolutely. I think you're on mute, Ryan.
Sorry about that. Looking at the time, are there any other questions folks have? All right, well, Mari, do you want to do thank yous for you all's supporters, and I'll thank for the chamber?
Absolutely. First and foremost, thank you to our sponsors, Vive and Gilead, who make this work that we do possible. We're so grateful for all of the ways that you allow us to extend into additional networks, into with our additional support from Mr. And I'd be remiss if I didn't say thank you to you, Ryan. Please extend our thanks to Tammy and Jennifer and the rest of the team for always being such great partners and allowing us to have this event today and to work with you as close as we do throughout the year. So big thanks to you.
Awesome. And Mario, you, Caroline, and Abigail, for your support of us in this Houston business action work is really critical. Also, thank you, Angel and Bianca, for joining us for this conversation. Really appreciate hearing your perspectives. And, as we at the Chamber work to grow both our local footprint in the Houston area, we feel it's really critical that we address this topic on a regular basis. So please do consider joining us at future Houston Business Action and HIV events. They are open to both community partners, small businesses, and our large employers. So we really do hope to get more folks involved. If you ever have any questions about being a part of our chamber as a chamber impact partner or member, feel free to reach out to me. And with that, I'll just say thank you all for having us and have a great day.
Thanks, everyone.
Thank you.